Welcome to the Smile Sisters podcast, powered by the LA Dental Clinic. In each episode of the Smile Sisters, host Dr. Ozzy and Dr. Arazu Nasiri show you how you can transform and maintain your smile. The sisters explain everything you need to know about your mouth and why keeping it healthy is key to your overall health.
Hi, everybody. We're back for another episode. Welcome. So today we're going to talk about what makes a beautiful smile.
Right. It's not what you would think. It's not just white teeth.
It's not just white teeth.
No.
Fair enough. And it's very subjective. But before we get into it,
Okay.
we have a special offer, which we'll talk about at the end of the visit.
Okay. Can't wait.
Okay. All right. So
At the end of the episode, you mean?
at the end of the episode, yes. It's a visit with us.
It's a
here.
visit.
So what makes a beautiful smile?
So I feel like a lot of people come in here just like, I wanted white, I wanted white, I wanted white. And white it's good. It's definitely not good to have yellow teeth. It's better to have whiter teeth. But is that all it takes to have a beautiful smile?
Often people are coming in and saying, I want a whiter smile. But white isn't the only characteristic of a beautiful smile.
No, not at all.
Yes.
So what are we looking at when you see someone who has a beautiful smile and you're like, wow, you have such a beautiful smile? What is it that we're actually like looking at? Like technically, what is it that makes it beautiful?
What makes a smile beautiful is that it flows with the rest of the patient's face.
Right.
It doesn't look out of place in their face. And often when we do a smile makeover, people say, my friends and family are not noticing my teeth. They're just noticing that I look better. I look healthier. I look, happier. I look rested.
Right.
And that just tells you that their smile has enhanced their features. It has enhanced their smile, the way they look, but it's not like sticking out. So people are not really noticing that it's the teeth, unless you have really something jarringly wrong with your teeth and you correct
Like
that.
you got a missing tooth and now it's not missing.
Right. So, or you have a black tooth and now it's white, you know. But if you had, a smile that you weren't super happy with and you just did some nice cosmetic work on it, then it's just going to enhance it. And most of your friends and family won't realize that you did your teeth.
Right. But let's get a little bit more specific. Like,
Yes.
for example, how important is it to have the center of your teeth match the center of your face, the midline?
Yeah. So
That's something that people also really kind of zoom in on. They want the center of their teeth to be the center of their face and also the center of the bottom teeth to match the center of their top teeth.
Right.
How important is that really when we're looking at someone's smile?
So it's not that critical. What becomes more important than having your midline be in the center of your face is having your midline be vertical. So what catches our eye is when you look at your teeth, they line up in a situation that is vertical, right? So the contacts of your teeth are in a vertical position. But if your teeth are a little bit skewed like this, right? So that your midline is maybe centered, but a little bit diagonal.
So the midline of your teeth is kind of going sideways compared to your face.
Yes.
That
So
really stands out.
That really stands out, yes. So you definitely want to have your teeth be in a vertical position in the center of your face.
Right.
Okay.
So they could actually be quite skewed as far as the position, but then if
Yes.
the midline is straight up and down, people don't tend to notice it. And a very famous example of this is Tom Cruise's smile.
Yes. So if you look at his smile, his midline is still off to one side of
It's
his
way
face.
off, yeah.
But if you look at his many years ago photos, his midline was also canted or skewed like this. And that's when it looked wrong.
Right.
They were able to do veneers or whatever they did, and they straightened it out so that it's vertical in his face,
Right.
but it's still not centered, as in it's not lined up right below
His
nose.
center of his two top teeth are still not lined up to the center of his nose, but we would consider him a very good looking person who has a beautiful smile.
Now you don't notice the problem with his teeth. It
No.
flows in with his face
Yeah.
because his midline is not canted anymore, even though it's not in the middle of his face. So that is one important thing. A canted teeth, especially in the midline, can be a huge problem.
Right.
The other thing is the axial orientation of your teeth. So our teeth.
Wait, what's axial?
So axial means from like the tip of the root to the tip of the biting edge of the teeth, right? So our teeth are aligned straight like this, right?
Yeah.
And they need to all point towards the middle. I call it the belly button rule.
Okay.
So think about all of your upper teeth. If they are pointing down, they should all be pointing at your belly button.
Oh, I see
That
what
makes
you
sense?
mean. Yeah.
So your front two teeth, your centrals, are the most vertical in your face.
Right.
Because your belly button is pretty much like right below them. So they're pretty much just coming in straight down. As you go further to the sides of your teeth need to angle a little bit inwards so that they're all kind of pointing down to your belly button. That's
Right.
called the belly button rule in my book.
The belly button rule,
Yes.
which is axial inclination.
Axial inclination. So if you have a tooth that's kind of flared out in the wrong way, everything might be aligned and look straight, but the smile kind of looks off. So if you start looking at the axial orientation of the teeth, you'll notice that tooth is kind of flaring outwards.
Right.
So you need to re-angulate that tooth so that it
Like
looks at your
one
belly button.
tooth can really stick out because it's not angled the right.
And it's all about flow. It doesn't flow with the rest of the teeth.
Right.
It doesn't flow with everything. So axial orientation is another thing.
Right.
The third thing is symmetry. So you want to have your two centrals kind of be the same shape. The two laterals kind of be the same shape. They don't have to be an exact match, but they have to flow together.
Right.
One of the things we look at is line angles. And line angles our teeth are not two-dimensional. They're not just flat. They have a flat surface and then they have,
But they're kind of curved.
they're curved. They have little angles. Think of it as like a box in a way, right? And our front teeth have these line angles, these lines that need to be symmetrical with the line angles of the next two teeth next to them.
Okay.
So
That's very
symmetry.
technical. I'm trying to think about how to explain it more normal so people can understand what that means actually.
Yeah. So if you go to a cosmetic dentist, one of the things that we do is we actually will take a pencil and draw the lines on your teeth so that sort of the angle of this tooth coming down this way on the side is going to mimic the angle of the next tooth coming down the other way. So there's going to be a symmetry in the pattern of how the rounded angles of your teeth together.
Right. So you don't want like your teeth to be basically bulking out in weird ways. You want it to flow like up and down, up and down, up and down symmetrically.
Yes.
Without like one tooth being like thicker, one tooth being thinner, as far as like how far it sticks out.
How far it sticks out and how much of a space there is between the edges of the teeth. So we look at negative space
Right.
of the teeth. So it's not necessarily just the shape of the tooth itself, but it's the shape of the gum line and the kind of bottom edges of your teeth.
Actually, that's another typical request is that people want their teeth to be straight at the bottom. But that is not good looking when you have your teeth just like in a straight line as if you just like filed them at the bottom. That doesn't look good.
I mean, that is an older look. And the reason for that is that when we're younger, our front two teeth are actually longer than the next two. And then our canines are pointy, so they're longer than the one to the side of them. As we kind of age and we grind our teeth, we file our teeth down naturally, so they become very kind of
Flat
same
and
length.
even.
Yeah, and they become more square edged as well.
Right.
So that's actually an older look. If you
Right.
think about an older people, they tend to have teeth that are the same length because they've worn them down. So if you want to look younger, you actually want to have this step where your front two teeth are a little bit longer, usually than the next two on the sides of them, which are usually about 0.5 millimeter to 1 millimeter shorter.
Shorter, yeah.
And then your canines, your eye teeth, when you smile, need to be about the same length as your front two teeth. So you're creating a little bit of a triangle shape between the teeth.
So basically the bottom edges of your teeth are not perfectly lined up. And that's actually more of a youthful look than having them all straight in a straight line.
So when we're deciding on smile shapes, we're looking at the patient's age, also their facial features. So if you're a big square-jawed guy, you tend to clench and grind your teeth and whatever. So we create more square-edged teeth because that kind of flows with the teeth. That's the other thing that just makes it look natural. If I give a big, square-jawed guy, like rounded, longer front teeth, it's just not going to fit his face. It's going to look really odd.
Like Tony from The Sopranos.
So you want to create...
He shouldn't have rounded teeth. He should have like angled teeth.
Sure. It has to flow with the rest of the face.
Right.
So the reason you notice teeth like that is because it doesn't fit in with the person. Conversely, if you have a young girl, a young, smaller kind of girl, and you give her really square, harsh looking teeth,
Right.
and she has maybe a rounder face, softer features, that's not going to fit in. Right. So you have to look for that.
Another common request that I get is people after, I think we had a patient like Maria that she straightened her teeth with Invisalign, and now the edges are a little bit ragged, right? The edges of the teeth, because of the way the teeth were positioned before Invisalign, got worn down. And now when you line up the teeth, the edges don't match up. Well, she is always saying, just shave it down, make it straight. But that doesn't necessarily make it look good, because there's also a thing that our eye goes to, which is the ratio of you explain that, the height to the width of the tooth, right?
Sure, yeah. So our teeth are not supposed to be square. They're supposed to have a rectangular kind of ratio, right? So they need to be longer than they are wide. Mm-hmm. So one of the things we're trying to do is maintain that. And that also makes things look natural.
Right.
So we always are looking at the teeth. Sometimes we can smooth ragged edges that are uneven. But often, if that's going to compromise the length of the tooth, where the length to width ratio is going to be compromised, then what you want to do is add to the edges. Right? The other thing to look at when we're doing that is the position of the teeth when they smile with relation to the lower lip. So when you have smile really big like this, you want your upper teeth to parallel the shape of your lower lip.
To follow that kind of like curvature of your lower lip.
Yeah. So if you smile, and your front, and there's a space between your lip and your upper front two teeth, maybe your lip kind of has this kind of curve to it, but your teeth go straight. That tells you have some room to lengthen your maybe front two or four teeth. But if you smile and there's no room there, you're pretty much touching your lower lip with your upper two teeth, then you don't have any room to lengthen that way. So that's another thing we keep in mind.
Wait, but going back to Maria and the ragged edges, I guess what I was trying to get to is sometimes it's more beautiful to leave the ragged edge than to chop the tooth down so much that you lose that ratio of the width to height.
Totally, yeah.
So if you are gonna like shave it down so much and lose that ratio that our eye perceives as beautiful, even though now it's smooth at the bottom, but it actually looks worse to us.
Totally, yeah. So you have to look at how you want to solve that problem. If it needs to be solved.
Right, like maybe it's better to just leave it a little bit uneven rather than to break that ratio. Isn't it called the golden ratio or something?
Yeah, and you see it in nature all the time.
Yeah.
This ratio that our eye goes to. So you want the width of the teeth to be about 3/4 of the kind of length of the teeth,
right?
And so that's that ratio. And then as you go back, the width of the central incisor, the two big front teeth, versus the width of the lateral incisors also has the same golden ratio.
Continues.
So it follows in nature, this ratio. It's really interesting.
Yes.
It also has to do with how our face is divided into sections as well.
Right.
So really, really cool stuff
really
to look
cool.
at.
It's really amazing how we instinctively see certain ratios as beautiful.
Yes.
And you don't want to break those ratios for the sake of having like a straight edge, because then it's going to make it look worse. We just naturally see it as less beautiful, even though now it's straight.
So I have this conversation. So for example, our patient Christian, she came and she wanted veneers on all her teeth, and she kept telling me how she wanted them to look square and look shorter and, have them be even smile. And one of the things I do probably on a weekly basis is say, no, we're not going to show. We're actually going to lengthen your
Everyone wants
teeth.
that, like straight teeth.
So for her and for many of my patients, what I'll do is I'll just take a little bit of filling material and just layer it on the edges of the front 2 or 4 teeth. It's temporary. We can just, peel it right off. But all of a sudden, they look at their smile and they see the difference that it makes. So don't discount that. Adding often is better than taking away in these instances.
Right. Another thing that can make us smile more beautiful and more youthful is how much tooth you show in a resting, kind of position. Not just in your big smile, but if you say the word Emma and then you just let your lips kind of rest, how much tooth are you showing?
Right.
That can really determine how we see someone's smile as being more youthful or less youthful.
For sure. So that, we look at the patient's sex as well as their age, right? So in kind of a younger female, when they're saying Emma like that, we want to see about half of the upper two teeth, right?
Yeah.
So in a slightly older person, maybe we want to see about a third. In a male, we want to see about a third. Now, these rules don't have to always be followed exactly, but it gives you sort of a guideline, right? So often, one of the most important photos that my team takes is the Emma photo. When I'm trying to design their cases, their cosmetic cases, I want to have this Emma photo or a video of them talking. And then I can evaluate, how much incisal display do they have? That's what we call it. Which is how much of their two front teeth, their incisors, do they show when they're just kind of lips at rest, but mouth slightly parted.
Right.
Yeah.
That's a reason to add, because as we get older and our teeth wear down, we also tend to get like longer upper, I don't know what this space is called between your nose and the top of your
philtrum.
Your philtrum tends to get longer.
Yeah, our soft tissue droops down, sadly, right?
Sadly, but surely.
But surely. So we end up showing more lower teeth. Think of like an old man,
Yeah.
You just, all you see is lower teeth.
Oh, it's all lower teeth. Yeah.
So what happens to us over time is our face drifts down, our soft tissue falls down. So we show more lower teeth. So then we're always like fighting that by trying to add to the edges of the upper teeth. Or if you have had a lot of wear. Also, now that women are getting lip fillers, and men as well, I should say, lip fillers tend to cover your lower teeth, or upper front teeth.
Yes.
So I am getting a lot of patients coming in and saying, my teeth don't show. And
the lips are bigger now, so they cover the teeth.
It's a problem.
It's a problem. Well, and good and bad.
It's good and bad.
Yeah.
And then the other thing is, how much gum do you show when you smile?
Oh, yeah. That's what I was going to talk about. Gummy smiles can actually be beautiful. Some people can show gum and we perceive that as beautiful. And some people can show gum and we perceive that as not beautiful. How does that work?
Again, it has to do with age,
Yeah.
And also, there's a lot of factors why we might show a gummy smile. It has to do with lip mobility, as in some people, when they smile, their lip just goes really high up.
Right.
And other people, their lip barely moves, right? So if that's the issue, if your lip is hypermobile, where you smile, it just goes right up to your nose and you show all of your teeth. Sometimes Botox. Sometimes we do surgery where we remove a bit of tissue in the fold of your gums and bring it together. So there's less like fold there, so the lip can't go up as much.
Right.
So those are ways to deal with it. Sometimes it has to do with the position of the teeth. The teeth in your jaw are just like down. And if the teeth are to have overgrown and come down, sometimes we do orthodontics, Invisalign or braces, and we move the teeth up. Right.
What makes the distinction? What I'm trying to understand is what makes one gummy smile look good and one gummy smile look not good.
So it has to do with the drooping of the soft tissue. When you're younger, your soft tissue, your face, like your skin of your face and your lip is sitting up higher. So as you smile, you show more gums. And as you age, this situation drops down.
It just gets
less and less. Yeah. So it's more acceptable if you think of like a young person when they smile, you just see all their gums, you see everything.
You see everything. Yeah.
You can see up to their eyeballs when they're smiling. So that's normal. And so often when I have younger people and they're like, I show too much gum, I'm like, it's good. You're going to look good in like 10, 20 years. It's going to be great. So don't worry about it. Again, when we were trying to figure out how much gum display we want to have, we look at the age of the person. And that helps us kind of determine where we want to go.
Okay. So as far as like, what are the top 3 things that you would say make a smile beautiful?
Well, I think the number one thing that I would say that makes a smile beautiful is the person's confidence. Okay. So when someone comes in and says to me, I don't smile, I cover my mouth, I don't like to show my teeth, then I know I have to do something about it. So as long as the patient feels happy with their smile, I'm happy. We had a patient yesterday, Kevin, who came back for a follow-up on his veneers. We just did veneers for him 2 weeks ago, and then he came back, we took our photos. He said, I got a promotion. And I think it's because now I'm looking at my boss in the face and I'm smiling at him and I'm talking to him and I'm more confident. He gave me a promotion.
Right.
So, it's not the teeth, but it's Kevin's, self-assurance now.
Self-view of himself.
Exactly.
Yeah.
And now he's able to like stand up and like look his boss in the face and talk to him more confidently. And that's the difference that doing this can make.
Right.
So the most important thing is that you feel good about your smile and you're confident about it. But
Okay.
from a technical standpoint,
Okay.
I think the number one thing is not having a canted midline. Okay.
Right.
So the first thing we talked about where it's vertical in your face, the connection of your front two teeth.
It doesn't have to be centered with your nose, but it has to be going vertical up and down. That really makes a big
Yes.
difference to our eyes.
It does make a big difference. The number two thing is flow, that it flows with the rest of your face, your age.
Right.
So it looks natural in your face. I think that makes a beautiful smile.
Right. So that, for example, all the bumps are even, it's flowing up and down evenly, and there isn't one tooth sticking out. It's all kind of flowing together.
Exactly. Everything kind of flows. The number three thing is symmetry, that the line angles and the embrasures, that means these little connections between the teeth that make the little V's, that are all symmetrical
Right.
from one side to the other.
Right.
And then incisal display, that when you're saying Emma or just talking, how much tooth are you showing?
Right. I think like I see videos online where people are shaving down their teeth with like a nail file or something. So you can really, I mean, maybe it's going to improve it a little, like improve the edges, but you can really break some of these rules when you cut a certain tooth in different ways. Like you can break the flow, you can remove the symmetry, and that can really make a bigger difference than if one edge is uneven.
Yeah, and exactly. So sometimes the trends of having everything be square, having the Hollywood look where everything's very square and the same shape and having super white teeth, those actually don't make a beautiful smile.
Right.
Contrary to what people come in asking for.
Right.
Having something look natural is what makes it beautiful.
Yeah. Having a Hollywood smile is not necessarily the same as having a beautiful smile.
Totally, yes.
Yeah. So what was our special surprise?
So if you are an existing patient of ours and you refer a friend or family, you will get a $100 credit on your account, and we will offer a $100 discount for your referred person.
Okay, wonderful.
Okay,
Thank you for listening.
bye.
Thank you for listening to the Smile Sisters. If you found this episode helpful, subscribe and leave us a review. To book a free consultation, go to ladentalclinic.com.